The military doctors at Fort Campbell thought they knew exactly who Victoria Thompson was. For 16 months, she had been the invisible nurse who assisted their medical procedures with quiet efficiency. With her stunning blonde hair pulled back in regulation style beneath her medical cap, and her ocean blue eyes that seemed to notice everything while revealing nothing, she moved through the base hospital like a ghost present but unremarkable, skilled but forgettable. Dr. Marcus Sterling barely acknowledged her existence as she prepared surgical instruments in Operating Room 3. The chief of surgery was focused on discussing complex trauma cases with his medical residents, reviewing procedures for treating combat injuries that could occur during the upcoming large-scale training exercise. Around them, the sterile surfaces of the Army hospital reflected the bright surgical lighting that cast sharp shadows across their faces. "The new trauma protocols are comprehensive," Dr. Sterling said to Dr. Hayes, his voice carrying the authority of someone accustomed to life-and-death decisions. "Every medical procedure for combat injuries has been refined to save maximum lives with minimum resources." Victoria moved silently between surgical suites, sterilizing equipment and preparing medical supplies. Her hands worked with practiced efficiency, but her ocean blue eyes tracked every conversation, every medical procedure briefly discussed, every protocol casually reviewed. She had perfected the art of being invisible, a skill that had served her well during her 16-month assignment at the Army's premier medical facility. Dr. Lieutenant Colonel Martinez glanced up from his patient charts as she approached to restock surgical supplies. "Thanks, Thompson," he said absently, already turning back to his conversation about emergency field surgery techniques. To him, she was simply part of the background, as unremarkable as the medical equipment and sterile supplies that surrounded them. The morning routine continued with clockwork precision. Doctors arrived, conducted their rounds, discussed classified medical procedures, and departed for their duties overseeing the treatment of America's military personnel. Victoria served them all with the same quiet efficiency, her presence so consistently unremarkable that she had become virtually invisible to the most medically trained personnel in the military healthcare system. "Thompson, the intensive care unit needs additional monitoring equipment," called Head Nurse Williams from behind her station. The senior medical administrator who supervised nursing operations treated her with professional courtesy, but like the others, she saw only what Victoria allowed her to see, a competent nurse who kept her head down and did her job without complaint. Victoria nodded and gathered medical supplies, moving toward the ICU, where soldiers recovering from training injuries required constant monitoring. As she worked, she moved beneath the watchful eyes of military medical personnel, whose expertise represented the pinnacle of combat medicine, each conversation providing insights into medical procedures that could mean the difference between life and death in combat situations. In the emergency department, she assisted with routine medical procedures while overhearing discussions about upcoming deployment medical preparations, field surgery protocols, and classified medical training exercises. The military doctors spoke freely around her, treating her presence as they would any other piece of hospital infrastructure. "The new battlefield medical protocols require enhanced trauma surgery capabilities," one senior doctor was explaining to his residents. "If medical personnel are compromised during combat operations, our ability to save lives depends entirely on the expertise of remaining medical staff." Victoria updated patient charts, but her trained mind cataloged the medical vulnerabilities being discussed. These conversations, seemingly routine to the participants, formed patterns that revealed operational weaknesses she had been sent to identify and assess. Dr. Sterling's voice carried across the emergency department as he briefed two visiting military medical specialists. "Fort Campbell's medical facility represents the pinnacle of military healthcare and trauma medicine. Our medical protocols are absolutely comprehensive, especially during high-casualty training exercises." Victoria finished updating medical records and moved toward the surgical preparation area, where she began sterilizing instruments with the same methodical precision she brought to everything else. But behind her unremarkable exterior, she processed the doctor's confident assertion about comprehensive medical protocols, knowing from her observations that several critical vulnerabilities existed in their procedures. The hospital operated like a precision medical instrument during the morning rounds. Victoria worked alongside 12 other civilian nurses, all of whom had been thoroughly vetted by Army medical security. None of them knew that the quiet blonde woman sterilizing surgical instruments beside them possessed medical qualifications and military decorations that exceeded those of most doctors in the facility. "Thompson, you're assigned to the mass casualty exercise tomorrow," Head Nurse Williams announced. "Secretary of the Army will be observing, along with several general officers. All medical procedures need to be flawless. Victoria acknowledged the assignment with a simple nod. High-level medical exercises always involved discussions of the highest classification levels, exactly the kind of intelligence-gathering opportunity she had been positioned to exploit. For 16 months, she had been building a comprehensive profile of vulnerabilities in the Army's most critical medical operations. As the morning activities concluded and the hospital entered its brief lull before afternoon surgeries, Victoria cleaned her equipment with the same attention to detail she applied to every task. Around her, the other nursing staff discussed personal plans and family obligations, normal conversations that reinforced her carefully constructed cover identity. Head Nurse Williams approached her station, reviewing the mass casualty exercise schedule. "The exercise begins at 0900 tomorrow," she said. "All nursing personnel need to be in position by 800 for final medical preparation." Victoria had been preparing for this medical exercise for months. She knew the procedures, the medical protocols, the placement of every doctor and specialist. Each detail provided another opportunity to observe and document the vulnerabilities that govern the Army's most critical medical emergency responses. The exercise preparation began at 1400 hours. Victoria worked with practiced efficiency, her hands moving through familiar motions, while her mind processed months of medical intelligence collection. The emergency procedures, the communication protocols, the medical response systems, all of it formed a comprehensive picture of the hospital's operational readiness and potential weaknesses. During the afternoon shift, Victoria noticed subtle changes in the hospital's routine that indicated something unusual was developing. Additional medical supplies were being prepared, specialized equipment was being tested, and senior medical personnel were conducting briefings with increased frequency and seriousness. Dr. Wells approached her station while she was organizing surgical instruments. "Thompson, have you worked with mass casualty scenarios before?" he asked, his tone suggesting professional curiosity rather than suspicion. "Standard training, doctor," Victoria replied, maintaining the same professional demeanor she had cultivated for 16 months. "I'm prepared to assist wherever needed." Wells nodded, but something in his expression suggested he was evaluating her response. "The exercise tomorrow will simulate conditions unlike anything we've practiced recently. Multiple critical casualties, limited resources, maximum pressure on all medical personnel." Victoria continued organizing medical supplies, but her mind processed the implications of what Dr. Wells was describing. A truly challenging mass casualty exercise would test not just standard medical procedures, but the ability of personnel to adapt under extreme pressure. "I understand the exercise is being observed by senior military leadership," Victoria said carefully, testing whether Dr. Wells would provide additional information about the scope of tomorrow's activities. "The Secretary of the Army, 3 general officers, and representatives from Army Medical Command," Wells confirmed. "They're evaluating our readiness for potential deployment scenarios where medical capabilities might be severely tested." This information aligned with intelligence Victoria had been gathering about increased military medical preparedness requirements. The exercise was clearly more significant than routine training, representing an evaluation of the hospital's capabilities under conditions that might reflect actual combat deployment scenarios. As the afternoon progressed, Victoria observed increased activity throughout the hospital. Medical personnel were conducting equipment checks, reviewing emergency procedures, and participating in briefings that suggested tomorrow's exercise would challenge every aspect of their medical capabilities. Dr. Sterling passed through the emergency department, inspecting preparations with the intensity of someone who understood that tomorrow's performance would have implications beyond simple training evaluation. His interactions with medical staff showed a level of concern that Victoria found significant. "All medical personnel need to understand," Sterling announced to the assembled doctors and nurses. "Tomorrow's exercise will simulate conditions where our standard protocols may prove insufficient. We'll need to demonstrate adaptability and expertise beyond routine medical procedures." Victoria listened to this briefing while maintaining her routine nursing duties, but Sterling's words confirmed what she had suspected about the exercise's true purpose. This was not simply training, but an evaluation designed to identify both strengths and weaknesses in the hospital's medical capabilities. The remainder of the afternoon was spent in intensive preparation, with medical teams reviewing protocols for treating multiple trauma cases simultaneously. Victoria participated in these preparations while continuing to gather intelligence about procedures and vulnerabilities that might not be apparent during routine operations. At 1600 hours, an urgent alarm sounded throughout the hospital. Victoria looked up from her work as the public address system crackled to life with an emergency announcement that would change everything. All medical personnel report to emergency stations. This is not a drill. Repeat, this is not a drill. Mass casualty event in progress. The hospital erupted into controlled chaos as doctors and nurses abandoned their routine duties and rushed toward their emergency assignments. Victoria watched from behind a medical cart as the most senior military medical personnel in the country mobilized for what appeared to be a genuine crisis. Dr. Sterling's voice cut through the noise as he coordinated with his medical staff. All trauma surgeons to operating theaters immediately. We have multiple critical casualties incoming from training exercise accident. Victoria felt her pulse quicken as she processed the severity of the situation. A mass casualty event during training exercises represented one of the most dangerous medical scenarios possible at a military installation. If multiple soldiers had been critically injured, the hospital's response would determine how many lives could be saved. Head nurse Williams appeared beside her, face grim with medical urgency. All nursing staff are to remain at assigned positions until further notice, she said. Emergency protocols require all medical personnel to maintain posts until casualties are processed. Victoria nodded, but her mind was already processing the implications of the crisis. 16 months of intelligence gathering had given her intimate knowledge of the hospital's emergency medical procedures, and she understood better than most nursing personnel just how serious a mass casualty event could become. Through the hospital's reinforced windows, she could see military vehicles racing toward the medical facility, their emergency lights flashing as they transported wounded soldiers from the training accident. Ambulances and medical helicopters converged on the hospital, creating a scene of organized medical chaos that tested every protocol Victoria had observed during her cover assignment. The public address system crackled again with an update. All personnel with advanced trauma surgery training report to operating theaters immediately. Multiple critical casualties require immediate surgical intervention. Victoria's medical training kicked in as she heard the specific terminology being used. Advanced trauma surgery represented the most complex medical procedures possible in military medicine, requiring expertise that few medical personnel possessed. Sterling's voice echoed from the emergency department, his words carrying clearly through the facility's medical communication system. We need someone who understands advanced combat medical protocols. The standard trauma procedures may not be sufficient for these injury patterns. Victoria felt a chill of recognition. Advanced combat medical protocols required specialized knowledge gained only through extensive field experience treating battlefield injuries, the kind of expertise that was carefully documented in classified medical personnel files. "Where's Dr. Rodriguez, our trauma surgery specialist?" Dr. Sterling's voice demanded over the communication system. "We need his expertise immediately." The response came back immediately, tinged with medical desperation. "Sir, Dr. Rodriguez is in emergency surgery with another critical case. He's unavailable for at least 4 hours. We're trying to locate other personnel with advanced trauma surgery experience." Victoria realized with growing alarm that the hospital might not have anyone immediately available with the specific medical knowledge needed to save the most critically injured soldiers. Advanced trauma surgery required expertise developed through treating battlefield injuries under combat conditions, skills that few medical personnel possessed. Head nurse Williams appeared again, her face showing the stress of the developing medical emergency. "All nursing staff are to assist where needed," she announced, though her own voice betrayed her concern. The situation requires all available medical personnel, but Victoria knew from her extensive intelligence gathering that the hospital's qualified trauma surgeons were either unavailable or already committed to other critical cases. Multiple soldiers were fighting for their lives, and the advanced medical procedures required expertise that might not be immediately accessible. The medical emergency continued to escalate over the next 30 minutes. Victoria listened to the communications traffic, her training allowing her to understand the medical details that most nursing personnel would find overwhelming. Multiple soldiers had suffered severe trauma injuries. The standard treatment protocols were insufficient for the severity of injuries, and the advanced surgical procedures required someone with extensive combat medical experience. At 16:45 hours, the situation reached a critical point. Dr. Sterling's voice over the emergency communications carried a note of barely controlled medical urgency. "We have 3 soldiers who will not survive standard trauma protocols. If we cannot perform advanced battlefield surgery, we'll lose them within the hour." Victoria understood the implications better than anyone else in the nursing area. Losing soldiers to medical complications that could be prevented with proper expertise would represent a failure of the military medical system. The soldiers' families would grieve preventable losses, and the Army would face questions about medical preparedness. She made a decision that would end her 16-month deep cover mission. Moving with sudden medical purpose, Victoria walked toward the emergency communication station in the hospital corridor. Her movements caught head nurse Williams' attention, who watched with confusion as the quiet nurse approached equipment that nursing personnel were not typically authorized to access. "Thompson, what are you doing?" Williams called out, moving to intercept her. Victoria paused at the communication station, her hand reaching toward the transmit button. For 16 months she had maintained perfect cover, gathering medical intelligence while remaining invisible to even the most medically trained personnel. But now, maintaining that cover would mean allowing soldiers to die from injuries she possessed the expertise to treat. She reached into her scrubs pocket and withdrew 2 small metallic objects that had been concealed there for over a year. The Purple Heart and Combat Medic badge caught the fluorescent light as they fell from her fingers, hitting the polished hospital floor with distinctive metallic sounds that seemed to echo through the suddenly quiet medical corridor. Head Nurse Williams froze, her eyes fixed on the medals that no simple nursing staff should possess. The Purple Heart represented wounds received in combat action, while the Combat Medic badge indicated advanced battlefield medical training that required years of specialized education and combat experience. Victoria activated the communication system with practiced medical authority, her voice carrying a command presence that had been hidden for 16 months. "Emergency Medical Command, this is Colonel Thompson, authorization code Angel 77 Alpha. I have advanced combat trauma surgery capability and am responding to critical casualties." The response was immediate, Dr. Sterling's voice sharp with surprise and hope. "Colonel Thompson, identify yourself and confirm medical authorization." Victoria's training took over completely. "Doctor, I am Colonel Victoria Thompson, Special Operations Medical Command, operating under classified deep cover assignment. I possess current certification for advanced battlefield trauma surgery and can perform life-saving procedures." Head Nurse Williams stared at her in shock, her understanding of everything she thought she knew about the quiet nurse completely shattered. Around the hospital corridor, other nursing staff and remaining medical personnel watched in stunned silence as the woman they had considered unremarkable for over a year revealed capabilities none of them had suspected. "Colonel Thompson, your medical authorization is confirmed," Dr. Sterling's voice responded. "Report to Operating Theater 1 immediately. We have multiple soldiers requiring immediate surgical intervention." Victoria removed her nursing cap completely, revealing her blonde hair freed from its regulation constraints. Her posture shifted from the unassuming demeanor she had maintained for 16 months to the confident bearing of someone accustomed to performing life-saving surgery under combat conditions. Head Nurse Williams found her voice. "Victoria, Colonel Thompson, I don't understand." She turned to face her, and for the first time in their 16 months of working together, Williams saw her true identity reflected in her ocean blue eyes. "Williams, I've been conducting a classified security assessment of hospital protocols while maintaining cover. My background is Special Operations Medical, specialized in combat trauma surgery." The hospital corridor's doors burst open as emergency medical personnel arrived to escort her to the operating theater. 2 military doctors, both wearing the insignia of trauma surgery specialists, approached with expressions that mixed relief and curiosity. "Colonel Thompson?" the senior doctor asked. "Dr. Wells, trauma surgery. We've been briefed on your qualifications. The casualties are critical." Victoria nodded, her mind already shifting completely from her cover identity to the medical challenges awaiting her. "What are the injury patterns?" "Multiple penetrating trauma, severe blood loss, potential internal organ damage. 3 soldiers require immediate surgical intervention beyond standard protocols." As they moved toward the operating theater, Victoria paused to address Head Nurse Williams one final time. "Williams, my assignment here was classified at the highest medical levels. The nursing staff were never meant to know my true qualifications." Williams nodded slowly, still processing the revelation. 16 months, she said quietly. "You were observing everything. I was protecting everyone." Victoria corrected, "Just like I'm about to do now." Victoria followed the medical escort team toward Operating Theater 1, her 16-month deep cover mission officially concluded. Behind her, the hospital corridor remained in stunned silence as the nursing staff tried to comprehend how the quiet nurse who had worked beside them had possessed medical capabilities none of them had ever suspected. The emergency medical escort moved quickly through the hospital's corridors, their path cleared by medical personnel who had been briefed on the developing crisis. Victoria's mind focused completely on the surgical challenges ahead, drawing on combat medical expertise that had been concealed behind her cover identity for over a year. They reached Operating Theater 1, where emergency medical personnel had established a surgical command center coordinating the treatment of multiple critical casualties. Dr. Sterling stood at the center of the operation, managing surgical teams while maintaining communication with medical specialists monitoring the crisis. When he saw Victoria approaching, his expression showed both relief and curiosity. For 16 months, she had assisted his medical procedures without either of them realizing her true qualifications. Now she represented his best hope for saving soldiers whose injuries exceeded the hospital's standard treatment capabilities. "Colonel Thompson," Dr. Sterling said, his voice carrying the weight of medical authority mixed with genuine gratitude. "Thank you for stepping forward." Victoria nodded, her focus entirely on the medical crisis. "Doctor, I need immediate access to all surgical equipment and authorization to perform advanced trauma procedures." "Granted. Whatever you need." Victoria approached the surgical preparation area, where multiple monitors displayed the vital signs of soldiers fighting for their lives. Her trained eyes immediately began assessing the medical information, analyzing injury patterns, and prioritizing surgical interventions based on combat medical triage protocols. The operating theater was filled with medical personnel working frantically to stabilize the wounded soldiers. Trauma surgeons prepared for procedures, while anesthesiologists monitored life support systems. Everyone understood that failure could result in preventable deaths among soldiers who had survived combat only to face medical complications. Victoria studied the medical charts with the focus of someone intimately familiar with battlefield trauma surgery. The injury patterns were severe, requiring surgical techniques that went beyond standard hospital procedures. Each case represented specialized medical challenges that demanded expertise developed through treating similar injuries under combat conditions.
Current status on the 3 critical cases? Victoria asked the lead trauma nurse monitoring the surgical preparations. Soldier 1, severe abdominal trauma with internal bleeding. Soldier 2, chest injuries with potential heart damage. Soldier 3, multiple penetrating wounds with critical blood loss. Victoria's hands moved across the medical equipment with practiced precision. She began prioritizing surgical procedures, coordinating medical teams to maximize the chances of saving all 3 soldiers. The operation required medical expertise and tactical decision-making that left no margin for error. Beginning advanced trauma surgery protocols, she announced, her voice calm despite the critical nature of the medical procedures. The first surgery involved repairing severe internal injuries that required techniques Victoria had developed during combat deployments. She worked with the precision of someone who had performed similar procedures under enemy fire, where any mistake could cost both patient and surgeon their lives. "Stabilizing internal bleeding," she reported as her hands moved through the complex surgical procedure, requesting type O-negative blood products and advanced clotting agents. As Victoria worked, she became aware that her actions were being observed not just by the surgical team, but by senior medical officers who had known her only as a nursing assistant. The transformation from invisible medical support to lead trauma surgeon represented a revelation that challenged everything they thought they understood about medical personnel and cover operations. "Colonel, we're showing positive response to the surgical intervention," reported Dr. Wells. "Blood pressure stabilizing and internal bleeding controlled." Victoria continued performing the advanced trauma surgery, her focus unwavering despite the attention her medical expertise had drawn. Each surgical decision had to be precisely executed, with no allowance for the kind of mistakes that 16 months of maintaining cover had trained her to avoid. The second surgery required cardiac procedures that went beyond the qualifications of most military doctors. Victoria's expertise in treating battlefield heart injuries, developed through multiple combat deployments, enabled her to perform surgical techniques that saved the soldier's life. "Cardiac function restored," she announced as the monitors showed stabilized heart rhythm. "Patient will require intensive monitoring, but should achieve full recovery." The third surgery represented the most challenging case, with multiple penetrating wounds requiring simultaneous surgical intervention on several organ systems. Victoria coordinated multiple surgical teams while performing the most critical procedures herself, demonstrating medical leadership capabilities that had been hidden for 16 months. At 18:34 hours, all 3 soldiers were stabilized and moved to intensive care. The medical crisis that could have resulted in multiple preventable deaths was resolved through surgical intervention that only Victoria possessed the qualifications to perform. Dr. Sterling's voice echoed through the hospital's communication system. "All medical stations, this is Chief of Surgery. The mass casualty crisis has been resolved. All patients are stabilized and receiving appropriate care." Victoria stepped back from the operating table. Her 16-month cover mission permanently concluded, but her primary medical objective successfully accomplished.
The medical emergency had required her to reveal capabilities that no simple nursing assistant could possess, ending her invisibility, but protecting soldiers from preventable medical complications. As the immediate crisis passed, Victoria found herself surrounded by medical personnel whose respect was evident in their expressions. For 16 months she had been invisible to most of them, assisting their procedures and maintaining their equipment while possessing medical qualifications that exceeded many of their own. Dr. Wells approached her as the operating theater returned to normal medical operations. "Colonel, that was extraordinary surgical work. How long have you been qualified in advanced battlefield trauma surgery?" Victoria considered her response carefully. "My medical background spans multiple combat deployments, including specialized training in emergency trauma procedures. This assignment required those qualifications to remain classified." The next several hours were spent in detailed medical debriefing sessions, as Victoria provided comprehensive analysis of the medical vulnerabilities she had identified during her cover assignment. Her observations about surgical protocols, medical personnel security awareness, and operational vulnerabilities formed a detailed assessment that would reshape Army medical procedures. General Patterson, who had arrived from the Pentagon to monitor the medical crisis, participated in the debriefing with keen interest. "Colonel, your assessment of our medical protocols will be invaluable. How many medical personnel were aware of your true assignment?" "Minimal essential personnel only, sir. The cover operation required complete medical compartmentalization to be effective." Victoria's report detailed numerous instances where classified medical information had been discussed casually in her presence, medical protocols that had been overlooked, and operational details that had been revealed through the assumption that nursing personnel posed no medical intelligence-gathering threat. Over the following days, Victoria's medical assessment report became the foundation for comprehensive updates to Army hospital security protocols. Her 16 months of invisible observation had identified medical vulnerabilities that conventional security reviews had missed, providing insights that could only be gained through sustained covert medical assessment. Head Nurse Williams requested a personal meeting with Victoria before her departure from the hospital. They met in the same medical facility where she had maintained her cover for 16 months, but now their conversation occurred with complete honesty about her true medical identity and mission. 16 months, Williams said, still processing the medical revelation. "You assisted our surgeries, maintained our equipment, listened to our medical conversations. What did you think of our medical capabilities?" Victoria considered the question carefully. "Williams, I observed dedicated medical personnel performing critical healthcare missions under demanding circumstances. The medical vulnerabilities I identified weren't the result of medical negligence, but of human nature and familiar hospital environments." Williams nodded slowly. "Will there be others? Other medical personnel like you, watching and assessing our procedures?" Victoria smiled slightly, the first genuine expression of warmth she had allowed herself during their entire medical working relationship. "Williams, effective medical security depends on multiple layers of protection, some visible, some invisible." 3 months later, Dr. Sterling was reviewing patient charts when he noticed a new nursing assistant in the intensive care unit. A young woman with auburn hair who moved through the medical equipment with remarkable familiarity for someone supposedly new to military medicine. When their eyes met briefly, he detected something in her expression that reminded him distinctly of the quiet competence Victoria had displayed before her true identity was revealed. "What's her background?" Sterling asked Head Nurse Williams, nodding toward the new nurse. Williams consulted her personnel files. "Sarah Chen, recent transfer from Walter Reed." "Excellent references, but her previous assignment details are surprisingly limited." Sterling watched as Chen efficiently organized medical supplies, her movements demonstrating knowledge of advanced medical equipment that went beyond standard nursing training. The same methodical precision, the same unconscious familiarity with trauma equipment that he now recognized as potential indicators of hidden expertise. That evening, as Sterling completed his rounds, he found himself observing his entire medical staff with new awareness. The quiet efficiency he had once taken for granted now carried the possibility that any member of his team might possess capabilities far beyond their apparent roles. The Purple Heart and Combat Medic badge that had fallen from Victoria's scrubs were eventually displayed in the hospital's Hall of Medical Honor, a reminder that critical medical expertise could be found in the most unexpected places. Below them, a small plaque bore a simple inscription, "In recognition of those who heal in silence until duty demands they step into the light."